is 1,034. The increases from last week, the headlines are clearly leaning positive. Headline number one, the FDA has approved the Johnson & Johnson vaccine. This vaccine only requires one dose, which makes the logistics of distribution much easier. Hamilton County Public Health has already received its first shipment
Is
of
1,034.
300 or so.
The increases from last week,
manufacturer will mean more overall vaccine.
the
coming to state of
headlines
Ohio, coming to
are
Hamilton
clearly
County.
leaning positive. Headline number
Morning,
one,
Dr.
the
Robert
FDA
Frank
has
from
approved
Children's
the Johnson
Hospital
& Johnson
is going to be
vaccine.
with us to discuss
This
the
vaccine
effectiveness
only
of the J&J
requires
vaccine.
one dose,
Some
which
people
makes
have
the
raised
logistics.
concerns that it might be less effective than Pfizer or Moderna, but it is extremely effective. Dr. Frank, who specializes in infectious disease and has run several clinical trials, will explain why you should jump at the chance to get the J&J vaccine or any other vaccine for that matter. Headline number two, Ohio is moving into phase 1C of vaccine distribution beginning tomorrow. People 60 and over are eligible, along with law enforcement officers, including Hamilton County deputies, and people with certain medical conditions. I know Greg is going to illuminate on that point. Visit testandprotectcincy.com if you are in this group to find links to the providers in our area that are providing vaccine. If you do not have access to a computer or are not fully adept when it comes to the internet, just call 211, and there are people to answer the phones when you call 211. Headline number three, the Board of County Commissioners will vote tomorrow on the administrator's recommendations for the county's remaining CARES Act funding. This is the residual from last year. This will include $4.35 million for a third round of small business assistance grants. We should have applications opening within the next few weeks. Not quite there yet, nothing to release yet, but we're getting there. In addition to Dr. Frank, Commissioner Reese is here. She will be discussing this morning the crucial steps for help for those experiencing economic hardship. And of course, Hamilton County Health Commissioner Greg Kesterman is here to run us through the numbers and the trends. So we will start with the Vice President of the County Commission, Commissioner Reese.
Thank you, Commissioner Driehaus, and let me say I want to thank Commissioner Driehaus and Commissioner Kesterman for all the work that they have been doing and are doing on COVID-19 as it relates to the health side. I also want to thank them because the Economic Relief and Recovery Task Force, one of the major initiatives is also equity, and I want to thank them for their work on the issue of equity. One of the things that we brought up this week is looking at Hampton University, which has a mobile unit that they announced nationally that will go into minority communities once the vaccine is more accessible. So we'll be bringing the vaccine to them. And I want to thank Commissioner Kesterman for being open to look at that model and seeing if we could have that model here in Hamilton County. So I want to thank him. I want to give an update on the governor. We submitted a request to the governor to look at the sewer rates because we want to make sure we bring down the cost to the ratepayers. Because of state law, our hands are tied. We need some things changed in state law, and we did submit some language and a request to Governor DeWine on that to see if it could be submitted and be a part of the state budget. He did get back with us and said thank you for the information, and they are definitely going to take a look at it, and we're waiting to hear back. We also asked him to look at giving us the flexibility to have a moratorium, possibly on taxes for senior citizens for their homes at this very tough time. Again, state law has our hands tied. We need some flexibility. He indicated that he would look at this very seriously and get back with us, and thanked us for submitting it. Also, the one-stop portal is being beta tested as we speak and should be ready to go hopefully by the end of this week or middle of next week, which will be a one-stop for all of your all of the places to go as it relates to economic help and relief. So we're happy to report that. Next week, we will be announcing a major interactive countywide event that will certainly go with, once we pass the CARES Act money that Commissioner Driehaus has indicated, having a major kickoff to get those funds to you through an interactive event that we will be unveiling next week. In addition to that, right now we've got help right now available, and we'll put the slide up now. It's called Prevention, Retention, and Contingency. And we have funding right now to help families. We have about $3.5 million that is available. And we would be able to provide help for people for the following things: rent, water bills, baby items, beds, and all of these are available. And the good thing about this is that some people, think that there is a requirement as it relates to if I make too much money. Well, a family of three making about $43,000, you're eligible for this. So this is one that I think more people should take advantage of. It is available and not enough people know about it. So we wanted people to be able to know about this. We know this is something that can help a single mother buy uniforms for kids that are going back to school. It's something that an aunt can help with their siblings through our kinship program. All of these are available right now. And so in order to do that, you can call until we get our portal up. You could get it right now by calling 946-7200, 946-7200, or you can send an email, and they are responding to the emails. And it's on the slide there, Hamilton Cares Funding at jfs.ohio.gov. So these are funds that are available right now that can help you get over the hump, and we'll have more help coming in the next couple coming weeks. Thank you.
Thank you, Commissioner Reese. We're going to turn now to Greg Kesterman, Health Commissioner for Hamilton County.
Good morning, and thank you very much. As we meet this morning, I continue to be able to report that we've seen reductions in the number of cases, hospitalizations, intensive care unit admissions, and other indicators that are all heading in the right direction. In addition, we are seeing continued vaccination clinics, more providers in our region, and now a new vaccine for Hamilton County and the rest of our country. So lots of forward progress happening right now, and it's really a time to be happy, but time to continue to remember to be careful so that we as a community stay ahead of this pandemic. One of the tools that we've had throughout the pandemic to help prevent the spread is testing. There remains a lot of opportunity in Hamilton County to get tested through the Test and Protect program, as well as many private providers. To find all of those locations, I recommend you visit our website, which is hcph.org. I'd like to take a look first at case numbers this morning. I'd like to point back to the highest peak we've seen, which was on December 10th. We had about 716 cases per day. Today, we are around 131 cases per day. So this is really great news. We're continuing to see a lot less COVID within our community. That said, there are still about 4,000 active cases of COVID in Hamilton County. So as I share all of these great signs and trends heading in the right direction, it's important to remember that COVID is still here, and we must continue to wear those masks and be careful when we're out and about. Very closely tied to the case number is our reproductive value, which has remained now under 1 for quite some time. This morning we are at 0.80, and the region being the same. This is another indicator that things are starting to constrict and things are heading in the right direction. A new graph this morning shows a comparison of hospitalizations, ICU admissions, as well as those on ventilators over the course of the pandemic. You can see through in the orange color, those represent those individuals that are in our hospital systems within our region. And we often were up around 800 individuals, and this number has come down to 219 patients today within our region's hospitals. The blue line represents those that are in our intensive care units, and you can see that we've been as high as 200 throughout the pandemic, and we are now closer to 58. So we have made significant decreases in both of those. Unfortunately, for those individuals that end up in the intensive care unit, many of them are on a ventilator, which means your disease has progressed to a very serious state. So it just is a reminder that COVID is real and has a serious impact on our community. Shifting now over to vaccine, as mentioned, we are excited that my agency and many providers in Hamilton County are receiving the new J&J vaccine for the first time this week. Our office received our first doses, which were 300 doses yesterday. And I think the most exciting part of this new vaccine is that it only requires one dose. So it almost cuts in half the amount of work it takes to vaccinate our population. So it's a really great tool and an effective tool in helping to reduce COVID. The other thing that's important to remember is all 3 vaccines that are now available are extremely effective at preventing severe illness and keeping people out of the hospitals. So this is really important, and it's a great victory for us as we combat COVID within our community. We now know that the state of Ohio has adjusted the eligibility requirements. The biggest jump is that now anyone starting tomorrow that is over the age of 60 will now be eligible for vaccine at any of the 50 or more providers in Hamilton County or in the state of Ohio. So to register to get vaccine, you will go to our website and look at all of the opportunities to register so you have the greatest opportunity to get vaccinated. In addition, new folks that are now eligible starting tomorrow include women that are pregnant, those with type 1 diabetes, those who have had bone marrow transplants, and those living with ALS. In addition, the governor announced in Phase 1C some new occupations that are now eligible for the first time, which includes individuals working in childcare, funeral services, and law enforcement and corrections officers. So a lot of new folks are now eligible, and so we will continue to do the tireless work to make sure that we can get vaccine to everyone in our community that is interested in having vaccine. Commissioner Driehaus shared, and I'll just reiterate it, but here in Hamilton County, we have really made a lot of progress in vaccinating our community, with nearly 15% of our total population having had received their first shot of vaccine. So that tells you we've made great progress, but we know we have a lot of work to go. Here in Hamilton County, we have also seen a lot of success in getting those that are over 80 vaccinated. Nearly 63%, or 2/3 of those that are over 80 have been vaccinated. So this is clearly having an impact on those severe hospitalizations. Our team is continuing to provide vaccine to many special locations, including going into our communities, to our senior centers, to our community centers, to churches that are opening vaccine clinics. We are also working closely with the Council on Aging, who are bringing seniors to us that are living in senior apartment buildings, and we're making big progress, lots of progress, vaccinating senior apartment buildings as well. So we will continue this work. I know there remains a lot of demand. If you're trying to get vaccinated and having difficulty finding a location, please continue to be patient, but please also continue registering with each location that has vaccine to give yourself the best opportunity. And then I like to close by reminding everyone that there are some tools that are very effective in this community and nationwide in slowing this pandemic down, and they're very basic, and they have been successful. And it includes wearing your mask, socially distancing, washing your hands, and if you're sick, please stay home and keep sick at home. These are the tools that we have that we know work, and they will help us get over this hump until we have enough of our population vaccinated. Thank you very much.
Thank you, Greg. And then finally, we've got Dr. Frank with us. He's the professor of pediatrics, Division of Infectious Disease at Children's Hospital. I should have mentioned your title earlier, Dr. Frank. I apologize for that. So I'm going to turn it over to you.
Thank you. Thank you, Commissioner Driehaus, and thank you for the opportunity. So I think just a couple things I'd like to elaborate on is that what things that you've mentioned, and then Commissioner Reese and the Health Commissioner Kesterman, about the different vaccines, because there has been some confusion in the community. And one of the things I think you have to realize is that you can't compare the 3 vaccines apples to apples, because they're really not the same design. The Moderna and the Pfizer vaccine are a 2-dose regimen, whereas the Johnson & Johnson is a 1-dose regimen. The other thing is that what the outcomes they're looking at were not identical, is that the Johnson & Johnson outcomes we're looking at, as Health Commissioner Kesterman mentioned, moderate to severe disease. And what that means is people that would otherwise be hospitalized or potentially die from the infection. The other thing too is that where the people have said, well, the Johnson & Johnson has had 85% ability to prevent against moderate to severe disease, the Pfizer and Moderna had 95%. Well, part of those may be numbers that are almost identical. But the other thing is important to look at is that while the studies for Moderna and Pfizer, as I mentioned, were based on a 2-dose regimen, there are some ability to do a sub-analysis to look at how well the vaccines performed after 1 dose. And after 1 dose, the Moderna and Pfizer vaccine are only about 60% effective. So you could argue that actually the Johnson & Johnson vaccine is equivalent or better than the Moderna and Pfizer vaccine after 1 dose. So I would argue exactly what Commissioner Driehaus and Reese and Health Commissioner Kesterman are saying, is that if you're offered a vaccine, or when you're offered a vaccine, go take it. Don't worry about which one, because all of them are doing the thing that we really want to do, is to keep people out of the hospital and to keep people from dying from this virus. And that one of the things also people have asked me is that, well, we've been vaccinated, why do we still need to wear a mask? And the reason being is because while the vaccines are very good at preventing disease, we're still not sure if they prevent infection. So it's possible somebody is protected against getting sick, but they could still have the virus in their nose, and that they could go out in the community and spread it to other people unknowingly. And so that's why we're still needing people to use the masks for right now. And that one of the things that we've done at Cincinnati Children's is that we've gone into the communities because we feel very strongly what Commissioner Reese and Driehaus were saying, as far as to make sure there's equitable access of the vaccine to everyone. And so we've been having a lot of presentations to professional societies, to churches, to organizations such as schools, the YWCA, and daycares. And one of the things that's been very rewarding out of that is that in a number of the presentations where we've gone back for a second presentation, people have said to us that we now understand more about the vaccine, we understand why it's important, and we went and got the vaccine. And so that we are seeing that the attitudes toward vaccines are improving, that more people are willing to take the vaccine, and I think it's critical that we get everybody vaccinated. And I guess the last point that I would make is about, people ask me, why do we need to immunize children? And part of the reason is, if you look, is that there's almost 75 million children in the United States. That's about 20% of the population. So if we don't immunize children, it's going to be really difficult to get the pandemic under control. And so that we have started doing trials in adolescents, and I see that that's going to be expanding into younger age children. So that I think in the not too distant future, certainly within a year, I think that we will have vaccines available for even young children. So I think that's the main things that I just wanted to go over. And so that I would say we are moving in the right direction. Things are getting better. Vaccine accessibility is improving. But one of the things that I feel very strongly about, we have to make sure we have an equitable distribution of our vaccines throughout the community, so everybody that wants to have a vaccine will get a vaccine. Thank you.
Thank you, Doctor. Thank you so much for lending your expertise. So with that, Bridget, I think we're ready for questions.
Thank you, Commissioner. First up, John London from Channel 5 has questions for Dr. Frank and for Commissioner Kesterman.
Thank you. And let me start with Dr. Frank. Hi, Doctor.
Hi.
How do we plan to expand? What are the mechanics of that, and how much can you do, in the weeks and months ahead compared to what you can do today?
Expand distribution of vaccine?
Yes.
I think I would ask Commissioner Kesterman to help with that one a little bit more, because my area of expertise really more is evaluating vaccines and giving results as far as how the vaccines are working. But I would say that if you look at the distribution of vaccines, that there was a graph from the CDC that's showing that we're continuing to have a very steep upward slope of the number of vaccines that are delivered per day. We're now in excess, I think, of 1.6 million doses a day that's being delivered in the United States, and it's moving in an increasing number.
Greg, while you're there, do you want to give us a sense? I know we're doing a story today with regard to what it's going to look like, and can you give us a sense of what you're going to be able to do in the weeks ahead?
Sure. There are several factors that will come into play as we start to move vaccine distribution out throughout Hamilton County and the state of Ohio. I think one of the biggest impact, or two of the biggest impacts that we will see moving forward is the J&J vaccine only requires one dose. So essentially that's half the work. So I think right off, any J&J doses that we receive will significantly decrease the effort of each of the providers. The second item that is really important to remember is in Hamilton County, we have 50 providers. Each provider does have the ability to administer more doses of vaccine, but in addition to those 50 providers, there's another 150 providers that have already been approved by the state of Ohio in Hamilton County that have yet to receive any vaccine. So what that means is without much effort, the state can give vaccine to an additional 150 providers and have even a greater impact. The third item that I'll share is with the J&J vaccine, the storage requirements are much less complicated than they are for the Pfizer and the Moderna vaccine. And so we have not really seen any primary care physician offices become leaders in vaccinating like we do see flu shots and other vaccines for our community. But with this much simpler storage process, I think we'll be able to increase the number of providers beyond 200 and to use some of these locations where people are familiar with getting their vaccines annually.
And so you got 300 doses yesterday. What, Greg, is the optimum way to utilize the single shot vaccine?
You know, I think there are some populations that would be served well with those doses. I mentioned during my comments that the Council on Aging is bringing people in buses to us at the Board of Elections. If they only had to bring individuals one time to us, I think there would be a great impact and we'd be able to reach more people quickly. So I think that's one population we're serving. But that said, these doses are valuable regardless of who gets them. So we're opening them up to the general population as well.
And Dr. Frank, we haven't heard about AstraZeneca for a while. And I know that you're working on that study at Children's. Can you share with us a little bit about what the outlook is with regard to that vaccine?
Sure. So that the AstraZeneca has completed their phase 3 enrollment, and that we're now they're just in the phase now of seeing if people get infected. What you have to do for the clinical trials is to accumulate a number of cases, and then you do an analysis to see how many are in the vaccine group and how many are in the placebo group. So that's the stage that AstraZeneca is in right now. The thought is that they would be submitting for an EUA probably within the next couple weeks. So that would hopefully bring us a fourth vaccine available.
And then just quickly, for either you or Greg, the Biden administration wants to give 3 weeks notice of supply delivery instead of 1 week. Do you know how soon that's going to start, and any thoughts about how that's going to, help planning?
From a public health perspective, for the first time, I heard from the state government that public health and other providers can anticipate receiving at least 75% of what they receive this week for the next 2 weeks. So over the course of the vaccine program, I have not really had any kind of indication what I can plan for next week. And now I know I can at least plan for 75%. And most likely I'll get the full allocation that I receive this week. But I can now start to fill appointments in advance. So I think we'll continue to get more information as we move forward.
And Dr. Frank, just briefly, you mentioned the vaccination of children. Are we looking at, so in a year, you say there might be a vaccination for children. Are we looking at not being able to achieve herd immunity until that is done?
So I think that we'll have a vaccine licensed for 12 and above by August, because that there have been enough adolescents. I think we'll have a vaccine there. The more people that we vaccinate, the sooner we'll get to herd immunity. so that if we are able to immunize 90+% of the adults, that will help us too. So that I think we need to continue to get out the message that vaccination is important, and that when we do have vaccine available for the different age groups, is that we really reinforce the importance of vaccine in that age group. So I think we can get closer to the herd immunity with just adults, but that I think to really get everything under control, having children immunized too will be important.
I know others have questions here, so, but the reason I ask that is because there's so much emphasis right now, a desire to get back to normal. You know, you've got states, Texas and Mississippi, that are lifting restrictions.
You went on mute.
I'm sorry.
Yeah.
Yeah.
So
sorry.
You were
No,
saying
on the
about Texas and
restrictions,
Mississippi. Yeah. Going on.
Well,
So,
go ahead.
so I think that one of the things we need to look at is that what's the likelihood of infection, and then what's the likelihood of severe disease. And I think of looking at what Health Commissioner Kesterman was showing you as far as the decrease in ICU admissions, the decrease in deaths, and that's really the critical thing. Coronaviruses are common viruses in our kids. Is that novel coronavirus happens to be causing more of a problem because none of us have been exposed to it before. But coronavirus typically causes a cold. And that's, if I drew blood on you, I'd probably find antibodies to 4 or 5 different coronaviruses. So that we want to immunize everyone eventually, but if we can target the higher risk groups, those are the groups that then we're going to have our biggest impact of decreasing hospitalization and death. And so I think it's important that everyone that has access to vaccine, that we really emphasize the importance of that. And if we get everyone in the 60, 65 above immunized, I think you'll see a dramatic decrease in deaths and hospitalizations.
Thank you for all of that.
Thank you, John. Next up, we have Ann Saker with the Inquirer. Questions for you, Commissioner Kesterman.
Good morning, Ann.
Good morning, everyone. Thank you very much for giving us a piece of your day today. My first question to you, Greg, and perhaps you said this and I didn't quite hear you clearly. The fate of those 300 doses that you received from J&J, are those all going to the Board of Elections site, or are you breaking those off into smaller allotments?
I am actually not certain the fate of each of those doses. I know certainly some of them are going to folks coming on buses from the Council on Aging.
Okay.
We have each week probably 20 different vaccine locations and a team of people kind of planning where we're going with each dose of vaccine.
And we've been, is there any further conversation about whether there will be a mass vaccination site? I've seen a report like at Kings Island or the Wilmington Air Park. Is there any conversation of like, now that we've got a more easily portable option, does that expand your thinking in terms of delivery and distribution?
There is lots of discussion happening at the state level about mass vaccination planning, and that would trickle obviously down into Southwest region as well. I think a couple of the concerns, we want to make sure from a health equity perspective, we're not forcing people to drive long distances to get vaccinated. And so we're making sure that any site that is considered would be a site that's close enough to the population that needs to get vaccinated. In addition, a big question also involves the number of doses. So if we're going to take doses out of Hamilton County and move them up to Kings Island, I think that breaks with the health equity piece. And so I don't think that works. But if it brings extra doses from the federal government into Hamilton County, I think we can all get behind that and support it, even if that location turns out to be in Warren County at Kings Island. And so there's lots of conversations happening, lots of planning happening, and we're very optimistic we'll see additional doses here in our region to help get more people vaccinated.
Is there a number threshold of doses that you'd like to see, that you'd like to anticipate before you would open a mass? I mean, it seems like the strategy is to go as small as possible with the allotments rather than to throw it open, as some states have, to large vaccination sites. Do you anticipate that happening at some point?
I would anticipate. I would anticipate at some point we see some sort of larger sites, but the truth is, if we have 200 locations in Hamilton County that prevent people from having to drive more than a few minutes from their home, there's a lot of power to getting vaccine close to people's home. Not everyone feels comfortable driving downtown, for example. Not everyone wants to pay for parking to go to Paul Brown Stadium. But if I can provide vaccine at the Meijer or the pharmacy in your neighborhood that's 5 minutes away, I think people are comfortable and more likely to go get vaccinated. So I think there's a balancing act that we're going to play with here.
Okay. My next question, quickly, I'll just run down these quickly, Greg, is are you satisfied that we're doing enough testing at this point in the pandemic to be sensitive enough to any surges we might see coming at us?
Over
doing enough?
Over the last couple of weeks, we have seen a decrease in testing, including through the Test and Protect program. I think there's a couple things at play. I think as people start to feel more confident that there is vaccine, maybe they have less likelihood to go get tested. But honestly, I think as there are less cases in our community, there are less people that feel sick and have the need to get tested. So I think there's a balance between those two. But the one metric that I've said throughout the pandemic that does not lie is hospitalizations. People who get sick with COVID materialize and turn into hospitalizations. And so if that number continues to decrease, then I think we're very safe and sound in our reasoning that COVID is decreasing within our community.
Are you concerned at all, Greg, about the lifting of mask mandates in Texas and Mississippi? And do we need to put them on a travel advisory here in Ohio to prevent folks from bringing virus here from Texas or Mississippi?
So I think at a statewide level, I think that policy would have to come from the governor's office, and I wouldn't want to speculate about what they're thinking about. But I think clearly we know scientifically that wearing masks, washing hands, social distancing help prevent the spread of infectious disease. If you look at the flu data for Hamilton County this year, there's hardly any flu hospitalizations. And we know that these tools that we have implemented have been extremely successful at slowing COVID, flu, and other infectious diseases this year. So while folks are tired of wearing masks, I don't personally enjoy wearing my mask. It is a small sacrifice that I can make and each of us can make to help ensure that we can get our county back to a normal state.
Thank you. And one question for Dr. Frank, if I might. Dr. Frank, are you concerned that we may at some point, 6 months or 12 months from now, that we end up having like pockets of herd immunity, like the cities develop enough immunity, but in perhaps rural communities or in underserved communities, we don't quite get coronavirus to herd immunity level? Or is that a part of the process that we go through here? How does this work?
So I would say that coronavirus is one of many vaccines that we would like people to receive. We would like people to receive a flu vaccine every year. We'd like to people as they're getting older to get a pneumococcal vaccine and a shingles vaccine, and we like the kids to be receiving all their routine vaccinations. We see for routine vaccinations throughout the country that there's a difference in level of immunization rates, and this is one of the things that the Academy of Pediatrics and the CDC continues to work on very hard to bring a equality or a equal number of people being vaccinated across the United States. We have seen for measles, for pertussis, that you get areas where people have decreased their immunization rates and you get outbreaks. I mean, one of the things that we're worried about is that one of the unintended consequences of COVID is that people haven't been going to the pediatrician's office as much as they had before because they're concerned that kids may get exposed or sick in the office. And so they haven't been getting the routine vaccinations as commonly as they had before. That's improving now again, but that is a worry because that's going to increase the likelihood of having outbreaks of disease preventable illnesses. Right. I mean, vaccine preventable illnesses.
Do you think people understand that herd immunity is not a constant, that it has to be continually sustained? And
I would say that one of the things with vaccines is that vaccines have been, to me, the two best things we've done in medicine. First is hand washing, and the second thing is vaccines. And that what's happened is that the vaccines have been so effective, not just for COVID, and this is just, to me, COVID has been just a testament of the science that has developed in the world and how fast we've been able to get these amazing vaccines. But if you look at vaccine preventable illnesses in general, is that young people don't know what diseases look like that used to routinely kill children. And so because of that, they don't understand the need to continue to vaccinate. So I wouldn't say that this is unique to COVID. I would say it's for vaccines in general, and it's why we continue to have the push to say that vaccines are so important, and then why everybody needs to be vaccinated.
Thank you very much.
Thank you, Ann. Next up, we have Corey Sharber with WVXU. He has questions for Dr. Frank and for Commissioner Kesterman.
Good morning, everyone. My first few questions are for Greg. Of course, you've received 300 doses of the J&J vaccine, but of course, I assume you have way more of the traditional 2-dose vaccines. So how are you selecting who receives each one? Are you focusing on, some of the new occupations that opened up to get the one vaccine dose and be done, or is it kind of a random choice at this point?
This week we're receiving about 2,300 doses of Pfizer in addition to the 300 doses of J&J vaccine. And it's really a function of making sure we can fill up clinic spaces. And so we are, as we work through, making sure we fill up those spaces, have a spot 3 or 4 weeks later to go back to do the second dose clinic, and putting the pieces together to make sure we're using every single dose each week. And so we're able to get those doses into our community.
And of course, it's still really early to call, as you're saying. You're never sure how many vaccines you're getting, a month or two from now. But when can we see more J&J vaccines come here? Like we're going from 300 to maybe 3,000 or so.
What Governor DeWine has indicated is that this week the state received just shy of 100,000 doses of the J&J vaccine. The next 2 weeks we'll see a slight decrease in those vaccines, and then it is anticipated after that we'll continue to see an increase week after week of J&J vaccine, as well as Pfizer and Moderna.
And I know last week we discussed the different variants are hitting the area. Are you seeing any new cases involving any of the variants?
So we still, in Hamilton County, to the best of my knowledge, only have one known person with the variant of the UK variant. In the state of Ohio, last week we had 11 cases of the UK variant. This week we are up to 19 cases. So we know it is here in Ohio. We know there's likelihood we'll see more cases here in Hamilton County, but at this point I believe we only have one case.
And again, like we're seeing the daily case number has just dropped dramatically since since December. And just thinking about that, it makes me wonder, how far away are we from finally going back to the orange level? It seems like forever ago, since things were not as chaotic as they are now. But when could we drop down a level?
The truth is, with this being a novel pandemic and us not having data on these new variants, I think we just have a lot of unknown. And I think if our community continues to consistently practice those safety measures that we talk about, I think we'll successfully be able to get through this pandemic without seeing significant increases. But I think there's a lot of caution that needs to happen in the weeks to come to keep us where we're at.
I have a question now for Dr. Robert. You mentioned that we need to start focusing on getting children vaccinated. And of course, right now, schools have been opening back up. A lot of schools are doing 6 feet of social distancing. Some are mentioning trying to do 3. There's a lot of them that are already doing 3 feet of social distancing. So what are the concerns with sending kids back to school without vaccines? Obviously, they're not going to get vaccinated this semester, but at the start of next year, what concerns does that bring up?
So first of all, I would reiterate what Commissioner Kesterman was mentioning as far as the effectiveness of the masks. And that while, yes, they are a little bit annoying, it's something I think that we need to do. That I do clinical care at the hospital, and it's amazing to me is that 2- and 3-year-olds will be coming into the office. They have their masks on. They very proudly are wearing their masks. So children are able to adapt. And that's one of the reasons I enjoy being a pediatrician, is because how well children can adapt to things. There's evidence that shows, as far as that, if you have a mask on. And it was just looking at a mask that you can decrease transmission by 85%. So that the social distancing, wearing mask, hand hygiene, all those work. The problem with them is that you have to do them every day, all the time. And that gets to be old. And that's where I see these measures as a temporizing thing until we have vaccine available for everybody. So going back to where you said having a mask on by itself, we've had good data to show that's about 85% the protection against transmitting infection. Is that if you have a mask and then you couple it with distancing, I think that you're going to increase. I mean, I don't have the data because that they didn't really do those combined, but just from a common sense standpoint, if this by itself is 85%, and then you have the distance on top of it, you're going to increase the likelihood, you're going to increase the protection. One of the things also that remember, and that I'm maybe Commissioner Kesterman can help me with this too, is that if you look at contact tracing, is that the number of cases that are spread in the school seem to be very, very small. And that most of the cases in the kids are happening outside of the school setting. When they're going to the mall or going to parties or doing other kind of gatherings outside the school setting. So everybody wants children to be safe. Everyone wants children to have an appropriate education, and that and part of education is socialization and play and interaction and that. And so it is a balancing act. But I think that there are good measures that can keep kids safe until we have vaccines available for the children. And it's going to be individual. I don't know that individual school, but you have to have enough space to be able to implement those measures.
That's all my questions. Thank you very much.
Okay.
Thank you. Next up, we have Jenna Ciceros with Local 12. She has questions for Commissioner Kesterman.
Good morning, Jenna.
Hey, good morning, Commissioner. Thanks so much for your time. So, quick questions for you today. Do you have any tips for people who may be struggling to get a vaccine appointment? And is there some way of knowing what's a good time to try to sign up for one of these vaccine appointments?
Honestly, the tools that I have heard work best are persistence. So trying to help folks get vaccine, I think the tool that works best is going to each of those websites a couple times a day and checking in and making sure that they don't have appointments. And what I hear is that random times throughout the day, a few appointments will pop up because of cancellations, and people have been getting success with getting their vaccines.
And then I may have missed this on the beginning half of this call, so sorry in advance if you answered this, but if you're newly eligible for the expanded guidelines, like starting tomorrow, are you asking people to re-register for vaccines?
So our website is kind of a registration bank, and we use everyone that's registered on that website to make sure that we're able to reach everyone that's on there. So there's no need to re-register. But for each of those other providers, some of them take registration, some of them only take appointments. So for example, if you log into a private pharmacy and they have no appointments available, I would ask that you daily go back to that private pharmacy and look for appointments. But at this time, everyone is equally eligible to receive a vaccine.
Okay, thanks so much. I appreciate your time.
That seems to conclude our questions from reporters.
Thanks, Bridget. Thanks, Commissioner Kesterman. I just want to follow up just on a couple of things that were mentioned. The one about capacity. So Greg mentioned that we have 50 providers right now in Hamilton County, but 200 are available to become providers. So we can quadruple our capacity through that pretty quickly. The other thing to remember is that the providers that are getting vaccine right now, which include the hospital systems and the public health systems and the FQACs, all also have capacity to expand what they're doing. So the capacity is additional providers being available and also increased capacity with the providers we already have. And so as you can see, we are building capacity in this community so that when we get more vaccine, we're ready to do that distribution. Secondly, there's been some talk about equity. We've talked about equity before. We do have some zip code information that we are studying to figure out how it's going out in the community by way of zip code and where the equity question really is. And so we're planning to present some of that information next week. We're compiling, where the neighborhoods are and what zip code matches up with what. So more conversation about the equity piece with the vaccine distribution coming next week. And then also, anecdotally, this idea about testing. Look, testing is so easy. I had a scratch in my throat last week. I have my mask on all the time at work, but I didn't want to infect anybody. And so I thought, well, you know what? I'm going to go get tested. And so I went to a site in Norwood. I was in that site, registered 5 minutes. They took me in, and 10 minutes later, I had been tested, no sweat. And then about 12 hours later, I had the results, which was very efficient, and of course it was negative. But if people in this community feel like they might have COVID, you don't know. Everything now it's like I'm not feeling well. Do I have COVID? Go get tested. We've got free testing in this community, and it is so easy to get. So that's at Test and Protect. Go to that website and get tested. It's available to everyone, and we encourage everyone to continue to use that resource. So thanks again to Jay. We're a little over time here for Jay, so he's tired. But thanks again for joining, and we'll be back next week.